Metal straps are not suitable for use during ENT procedures. The primary reason is that metal is a conductive material. In the surgical environment, particularly during ENT surgeries, electrical equipment and lasers are frequently employed. If a metal strap comes into contact with such equipment, it can create a pathway for electrical current. This can result in burns to the patient or other electrical injuries. The delicate nature of the structures within the ear, nose, and throat makes them particularly vulnerable to such hazards. Furthermore, the presence of metal straps can interfere with the surgeon's ability to visualize and access the surgical site. The metal can obstruct the view or physically impede the manipulation of instruments, potentially leading to complications during the procedure. Instead of metal straps, several alternative materials are recommended for securing dressings or instruments in ENT surgeries. Firstly, non-conductive tape is a safe and effective option. It does not pose a risk of electrical burns and can be easily applied and removed. Secondly, sterile gauze is another commonly used material. It is absorbent, gentle on the skin, and does not conduct electricity. Thirdly, cotton balls can be used for packing or applying medication to specific areas. Like gauze, cotton is non-conductive and safe for use in ENT procedures. Fourthly, adhesive dressings can provide secure and comfortable coverage for wounds or incisions. These dressings are typically made from non-conductive materials and are designed to minimize the risk of complications. It is crucial to adhere to established safety protocols and guidelines when selecting materials for use in surgical procedures. Prioritizing the patient's well-being and minimizing the risk of injury are paramount. The use of non-conductive materials, such as those listed above, is a key component of ensuring a safe and successful outcome in ENT surgeries. Considering the potential risks associated with metal straps, it is imperative to use alternative materials that do not pose a threat of electrical injury or interference with delicate structures. The materials mentioned earlier, such as non-conductive tape, sterile gauze, cotton balls, and adhesive dressings, are all designed to provide securement and protection without compromising patient safety. Furthermore, ensuring the proper training and education of all surgical personnel is essential for maintaining a safe operating room environment. This includes providing comprehensive instruction on the proper use of surgical equipment, the identification of potential hazards, and the implementation of appropriate safety measures. Regularly reviewing and updating safety protocols is also crucial to keep pace with advances in medical technology and best practices. By prioritizing safety and adhering to established guidelines, healthcare professionals can minimize the risk of complications and ensure the best possible outcomes for their patients. In addition to the materials already mentioned, other non-conductive options may be available depending on the specific requirements of the procedure. These may include specialized surgical sponges, silicone-based adhesives, or other biocompatible materials. It is important to consult with experienced surgical staff and review relevant medical literature to determine the most appropriate materials for each individual case. Moreover, maintaining a sterile environment is paramount in preventing infection and promoting healing. All materials used in the surgical field should be properly sterilized and handled with aseptic technique. This includes wearing sterile gloves, gowns, and masks, as well as using sterile instruments and equipment. Proper sterilization procedures help to eliminate harmful microorganisms that can cause infection and compromise the patient's recovery. In addition to material selection and sterilization, effective communication among the surgical team is essential for ensuring patient safety. Clear and concise communication can help to prevent errors, coordinate actions, and address any unexpected situations that may arise during the procedure. Regular team briefings, clear communication protocols, and a culture of open communication can all contribute to a safer and more efficient operating room environment. Furthermore, it is important to continuously monitor the patient throughout the procedure to detect any signs of complications or adverse reactions. This includes monitoring vital signs, assessing for bleeding or swelling, and observing for any changes in the patient's condition. Prompt recognition and treatment of complications can help to minimize their impact and prevent long-term consequences. After the procedure, providing appropriate post-operative care is crucial for promoting healing and preventing infection. This may include wound care, pain management, and instructions on activity restrictions and follow-up appointments. Patient education is also important to ensure that they understand the signs and symptoms of potential complications and know when to seek medical attention. By providing comprehensive preoperative, intraoperative, and postoperative care, healthcare professionals can optimize patient outcomes and minimize the risk of complications. The importance of using non-conductive materials in ENT procedures cannot be overstated. The potential risks associated with metal straps, including electrical burns and interference with delicate structures, make them an unsuitable choice for this type of surgery. By prioritizing patient safety and adhering to established guidelines, healthcare professionals can ensure the best possible outcomes for their patients. Remember to always consult with experienced surgical staff and review relevant medical literature to determine the most appropriate materials and techniques for each individual case. Safety should always be the top priority in any surgical procedure.